Okay, so we're talking about the times when functional medicine may not work for patients. We have a lot of patients that come to us that have been to functional medicine doctors and they've not gotten long-term results. We've talked about the brain-body connection. We've talked about the type of supplements that need to be used. We've talked about the structural aspect. So what's important is you need to realize that the body has to be treated as a whole. There is the neurological component of health, which is your brain. There is the metabolic component, which is the nutritional or the functional medicine. And then there's the structural, which is your chiropractic, your postural, your tissue, and how the body interacts with each other. When you evaluate all of these areas, you'll find the part that's not functioning properly, and you can determine what needs to happen. That sweet spot right there is where you find healing. That is where you find the brain starting to function properly and subluxation starting to be disappeared so the signal can get from the brain to the body. When the signal gets from the brain to the body, now you have the metabolic status to be able to carry out the function, which means that your body can now be in a state of ease or homeostasis and your body can heal. This is how it works. In our office at The Fix, we do not treat disease, we do not cure disease. We support the body in the areas that are weak and allow this pathway to work properly so the body can get itself back to ease. The body is a self-healing organism. The only time that it can't heal is if there's interference in that pathway. Our job is to find the interference, rebuild the pathway, and let the body do what it does, because the body is a much better healing than any doctor I have ever met. Hope that makes sense.